Right. Good morning, good afternoon, good evening, everyone. Thank you so much for joining today's podcast. The topic of today's podcast is artificial intelligence in population health management. And we are honored to have Mr. Vijaykumar Viradia, who will be joining us. Vijay is a technical project manager at Innova Care Incorporation, the AI cloud for healthcare performance. Vijay is a distinguished professional who has worked with Fortune 500 companies in delivering healthcare solutions, known for his unique blend of AI, project management, healthcare IT expertise, and delivering population health management solutions, and business acumen. He holds a certificate in PMP Safe, Microsoft, and CSM. Vijay has led a team of architects, business analysts, developers, operation staff for implementation of healthcare system. Vijay, thank you so much for joining us on the podcast today. All our audience are really eager to learn about the implications or implementation of AI specifically in the population health management. We want to learn more about. Before we start, I'll just ask you to, for the sake of our audience, give a brief about yourself, your expertise, how long you have been in industry, what attracted you to population health management. It's kind of a niche and unique subject. We want to really know about everything and hear more from you.
No, thank you, Fardin, for joining me on this podcast, and thank you, the new World Foundations, for allowing me as a panel over here. Yeah, so thank you for that. Yeah, so my healthcare journey start when I was like working with GE as a consultant over there, and when we were working for like a breast cancer device, and then a pre-market release, that is a PMA approval, we need to like test a human, right? And then at that moment, like we are testing a human, a lady like who was just like a tasting, helping us to a better a solution for the
Mhm.
breast cancer device, right? And what we found that she has having the breast cancer, and
Oh.
that was a moment that I feel like, oh man, this is what. And at that moment, like when we found all the informations, we shared with the that lady as an like
Mhm.
a taster, right? She was crying a lot, and then like she's like thanking us that, okay, you guys like saved my life. And that moment, like I feel like, okay, this is the what actually I want in my life. So that's why I just
Mhm.
started choosing the healthcare as my passion, and then slowly I moved to the population health activity, right, with Innovators, my current company. I have
Mhm.
been with Innovator with last 3 years, and then we are implementing a population health management solutions
Oh.
to various healthcare providers. So I'm working with the Fortune 500 providers, right? It's California and uh, uh, east and the east based the providers. Yeah, we are helping them to identify the risk patients, having a better care, and also saving some cost for them. Yeah, so that's me. That's the Vijay. Yeah, thank you.
Well, that's a wonderful background which you gave, and I can relate to what you just mentioned. Like a person who is testing the application which you guys are developing, and then we end up finding out that person is the one who will be the eventual beneficiary. So it really helps us to see the actual tangible solution working for the people or the eventual end target audience, which or the target population which you are working on. So, uh, Vijay, I understand this is a niche topic. Quite a few of us know about it, but for the general audience, for a layman, want to help understand what, let's say, from my perspective, what I understand is population health management. We call it PHM in abbreviation or short form. It involves health in a very simplistic world. If I say, if it involves like health management or health outcome for a group of people by addressing their concerns, their needs, their healthcare needs specifically. So, and the end goal of the entire population management, the outcomes or the solutions or the tools or technology which we develop, it's which I understand from my perspective is like, we help enhance the overall quality of healthcare, we reduce the cost, we increase the outreach, and probably address the inequalities. That's the reason we cover the entire population. We call it PHM or population health management. But from your perspective, I want to understand like, what exactly is population health management? You are the expert here. Help us, our audience, understand what exactly goes into population health management and why it is important in today's healthcare landscape.
Yeah, sure, Fardin. And I think whatever that you explained, that's correct. about the PHM or the population health. So let me talk about like what is population health, right? And just
Mhm.
explaining a little bit what you already said, right? So population health management is a strategy aimed at improving the health outcomes of a group of individuals, right? So
Okay.
we have a set of people, communities, and we are thinking about like how we can improve the health for them, right? So this is a critical approach today in the healthcare landscape, because it shifts the focus of any providers from like reactive patient care to proactive patient care, right? So
Wonderful.
when you are when you are in the method of a preventive or the proactive, right, it means that you are helping a person and before any critical issue appears, like you are helping them to solve, right? So that's the reactive, that's the proactive and the preventive. Yeah, so that's population health. And if I
Okay.
take any example about like the critical the care, like about the diabetic, right? So by
Mhm.
analyzing the data of a populations, like we can identify the risk factor, like okay, out of like million people, like how many are the risk, how many people are the more riskier than other, right? And
Okay.
then we can implement the preventive measures for them, right? And then we can identify what are the different resources we can utilize to help them. Yeah, so that's about population health management.
So
Yeah.
I'll interrupt you here. One question I just received is
Mhm.
audience asks, what's the difference between population health management and public health management? The words quite seems quite similar, but I'm sure
Right.
like you can explain it better. Or there might be some minor differences between the two, or maybe they have some lots of similarities as well between them.
No, that's correct. Yeah, actually, when I started a population health management, I also like confused between okay, like we already talking about the public health, but then now what is
Mhm.
population health, right? So public health in general is talking about the health of all the populations, like entire populations. While population health is a subset of the public health, right? So
Okay,
we are talking
wonderful.
about a specific a set of community with
Hmm.
a particular age range or a particular what can the particular condition they are living, right? So we're talking about that, and we are trying to improve the health for them with certain conditions. So
Got it.
that is actually the population health. And if I take an example of a
Mhm.
public health perspective, right? So when we are talking about the public health, the government actually try to educate the people about like the vaccination. Let's take an
Okay.
example about the influenza vaccination that generally we take every year, right?
Mhm.
So what government is trying to do, like they are not giving the vaccination, but they are helping us to understand why you need it, like when
Mhm.
you need it, right? And they actually monitor the overall vaccination rate, and then also track like it is effect over the population or the public health or not, right?
Got it.
So that's a example of a public health. While a population health, we discuss about like a particular let's take a breast cancer example that I
Mhm.
have shown discuss, right? So like
Correct.
the breast cancer for the ladies that is more than like 45 years and between like less than 65 years, and we are talking
Mhm.
about them, we are thinking about like whether they have taken a precautionary advices on the breast cancer, right? So that is the populations we are talking about, and public in general is most of everyone. Yeah.
Wonderful. No, I can also relate and think about an example like going back to COVID-19 times when the
Okay.
coronavirus pandemic was there. So the policies and the regulations which were being rolled out by CDC, they were specifically targeting the public health outcomes. And
Correct.
then within that public health pandemic, which was around the world or within the nation here in the United States, we identified there is a particular ethnicity, people of color, or specifically people of color and the women above 50 years of age or 55 years age, which were more susceptible, which were more vulnerable population. So they had to be prioritized in vaccination. So that is covered under population health management.
No, absolutely correct. Yeah.
Okay,
So
wonderful.
that's a COVID-19 is a real example of a
Sure, sure.
public health. Yeah. Yeah.
So help us understand, Vijay. This is a very important topic, but you can give us some in more information why it is population health management specifically. Why is it important in today's healthcare landscape?
Yeah, and I think that's a good question. So population health management is a very crucial today's like as our fast-paced journey, right? Yeah, and let me give this in a set of a different points, right?
Mhm.
So let's take a first point about the quality of care.
Okay.
Correct. So by focusing on preventive care and early interventions, PHM improve the overall quality of a care, right?
Mhm.
So let's take an example of a chronic disease management. Like the best example is the diabetic, right? It's a
Mhm.
chronic disease. Right? So with various data sets, a healthcare provider can identify patients at risk and
Mhm.
implement preventive measures such as dietary counseling or maybe regular screening of that, right? And manage uh, the disease before it leads to several complications. Yeah,
Got it.
so that's a first a point that we can talk about. Like it's improving the quality of care, right? Another critical factor in the US healthcare, right? It's the costliest all over the world, right?
Mhm.
So PHM actually helping the providers and even at least the patients, right, to have less costlier healthcare. Like take an example, like a PHM program can help hospitals to reduce readmissions, right?
Mhm.
So by ensuring that discharged patients receive the proper follow up, right, and he can get the better outcome from the whatever the services they have taken, healthcare services. It means that they
Absolutely.
are not going back to the hospitals, and then readmission rate is like the biggest challenge in the US healthcare today, that can reduce the cost a lot, because emergency um, cost is like almost 300% or more than our regular PCP cost, right? Yeah.
True.
So that was the another thought maybe I can add on.
No,
uh,
wonderful example. Sure, sure.
yeah. And also like another challenge in the US healthcare, right? If I'm talking about like the resources, right? So we are always lagging behind the number of providers we need,
Mhm.
correct? So with the help of the PHM analytics, we can identify like, okay, how many high risk patients are there and how many of them that need a real time or as like continuous care, right? So we can
True.
associate that particular patients with the required the resources or the providers that we can manage the resources. Like, and you give the example of COVID-19, like what happened
Mhm.
at that moment, right? So the every all the healthcare system all over the world, like they are struggling just because of that, because there are a lot of patients are there and we don't have the providers. So at
Absolutely.
that moment, like PHM kind of solution can help to identify that, hey, this is the area, this is a hospital, we have a more patients, more issues, right? Then we can like associate all the resources to that particular area and resources, and that can help us overall things. Yeah. So there are things apart from that, like we can improve the patient engagement or like health disparities as well. Yeah.
Yeah. So actually, I was coming to the next question. You partially answered that, but probably I'll ask you to briefly provide me some more information. Some things which I was learning before when we identified this as the subject of our podcast today was we talked about the disparities and inequalities in providing healthcare and even access to healthcare.
Mhm.
Even within United States, we see there is a huge disparity. People who are living in the urban areas in big cities, they have much more advanced facilities, much more easier access, and much more higher options for getting healthcare. Not only the reactive or the emergency or the surgical requirements which they have, but even the preventive healthcare, they have much more access than the people in the rural areas or the villages and the countryside. And we also talk, and you rightly touch base upon the topics of preventive healthcare. Then we talk about the preventive tools and early intervention as one of the key measures which goes into the implementation of population health management policy or any implementation of any advanced tools or technology which addresses the population health management concern. I also learned something about the social determination of health,
Correct.
determinants of health rather, SDOH. So
Right.
that also looks into the concept of addressing the key challenges which are being faced by that particular ethnicity or the population, if you use the term which as part of the PHM. So, what from according to your perspective, what are the typical key challenges which are used to address as part of this SDOH implementation from the overall population health management perspective,
Yeah.
specifically in the current environment, the current world today?
Correct. And I think you rightly touch about the SDOH.
Mhm.
So what the population health actually management, like we discuss about, like it's a collection of the data, and the data is not from one particular source, and
True.
not only the healthcare data, right? So where the person is living, how much they are earning,
Oh,
what
yeah.
are the cleanness environment the person is having, like those also affect directly to the health, right?
Mhm.
And SDOH is already talking about that. So when we talk about the challenges in the population health management, right? So as I told, like, we need a data, right? So if we don't have a data, we have a data integration and interoperability, then it is very much difficult for us to have a right solution for the population health management, right?
Mhm.
For example, like, I have a hospital, I have a clinics, right? They both are in the different EHRs. They both EHRs are not working. It means that if I'm a patient going to clinics or maybe hospital, the provider at that place, they don't have my 360-degree view, right?
Mhm.
That's the biggest challenge, right? So if
True.
we don't have interoperability, integration, then this is
Mhm.
the biggest critical aspect over here. The second, I want to touch base about the privacy and security, right? As a human, as a patient, I want to know that how you are using my data, or like, and how you are protecting my data, right? So that
Mhm.
is another challenge, because when we talk about the PHM, we are talking about like the data from like almost like 15-20 different tools, and we are interconnecting it, right? So it's a the critical challenge for implementation of that. Another
Well,
aspect that I want to touch base about, the reliable collection of data, right? It's accurate
mhm.
data, right? Like, if, and I just take an example of one of my experience in my implementations, that so one of the clinic, they're not providing the data to me for that, and they have their own legal challenges, right? So it means that in our innovators PHM solutions, we don't have a data for that particular durations. It means that the solution, whoever is using the provider, they don't have the 360-degree view of the patients, right? Apart from that, another challenge is I want to talk about the patient engagement, right? The
Mhm.
patient may be reluctant to participate, right? Maybe if I have a PHM initiative about like a hypertension, right? And
Mhm.
if I'm not putting a data back to the system, then then the population health initiative doesn't have the correct view of my data, right? And
Mhm.
it's this challenge. And also, when we talk about healthcare, we have to touch base about the policies and the regulations, right?
Mhm.
It's changing, evolving every day. So we, as a solution provider, as a population health management, we need to take care of consideration of those things, right? And also like the scalability. The thing is that, like, it is not possible that you implemented a PHM solution at one place that will work for others. Take an example. I take a solution created for urban areas, right? Right? For a specific set of people and the particular age range. And if I apply the same solution, same care plans to the rural areas, that will not work, because as you correctly mentioned, like SDOH, right? They have the different environment, right? So the solution cannot work. So all this aspect that we need to cover, and these are the currently challenges in the implementation side. Yeah.
Absolutely, no, nice thought. And specifically, I think so. I had in one of my research paper, I had mentioned about we were talking about the application of drones and the utilization of drones in delivering healthcare solutions in in African continent. And there was an organization, I think so, it was IBM or some other large organization. They tried to implement the solution which was already being used in New Jersey and Wisconsin in the
Mhm.
Central African countries. It failed completely initially because of the specifically talked about algorithm bias, data bias. So when and we cannot really reapply the same data and the outcomes of the data which we are trying to utilize to do the SDOH integration, as well as doing the outcome, like trying to earn the outcomes of the implementation of technology in PHM to deliver the results for us, because the population as such are very disparate,
Right.
and they have their vivid population, and even the within the population we have different groups, different subgroups and ethnicity, which react differently to that kind of the care policy or the preventive care policy which we design. So but it's wonderful. For the first 20 minutes of our podcast we have been talking about PHM, but we haven't touched about artificial intelligence yet. But
Yeah.
thanks to you have explained it so nicely and wonderfully that I think so, at least for me and the audience, I'm sure we now clearly understand what exactly is population health management. Now when we go back to our drawing board and we probably read more about it, we'll surely not be confused about the difference between population health management, the general healthcare services, and the outcomes, as well as the public health policies defined by the federal government. So let's come back to the main topic of our discussion. I know it's 20 minutes already. So from artificial intelligence perspective, you know, you also touched base few things about without mentioning the term artificial intelligence. You talked about data analytics. We talked about preventive care. We talked about predictive strategies as well. We also talked about interoperability. We talked about integration of SDOH rather, and then we also touched base upon personal care deliveries solutions. But from your perspective, we want to understand, and I'll ask a very generic question. How does artificial intelligence help in population health management process?
Okay. Yeah. So thank you for that. Like I hope like people understand more clearly with my podcast and my answer.
Oh,
Yeah.
yeah, absolutely.
So let's come to the real topic today. And my
Mhm.
my thought was like let's have a little bit background of the overall PHM, and then now we can touch base of the AI part.
Sure.
Right. Yeah. So let's understand before even like jump to the particular AI things. Let's understand what is the PHM process are there, right? So population health management process, like it's like 5 to 6 steps process. Number
Mhm.
one is the data collection, right?
Mhm.
Like you need to collect the data, then you need to integrate data into the system. Third is that you need to analyze those data, right? Fourth is like you need to identify an outcome, generate the outcome like dashboards and the outputs from it.
Mhm.
Fifth is where actually the you can get the benefit to the decision making, right?
Correct.
So these are the like 5 steps of any a PHM solution you are going to implement. And let me touch base for each step how AI can helping us over
Mhm.
here. Like so, let's start with the data collections, right? So AI can automatically enhance the data collection process by gathering information about the different EHRs, different clinics, a different third-party data companies, right? So and in this like I want to talk about the innovators, like the we at the innovator, what and how we are using the AI, right?
Mhm.
So innovators, our AI powered platform that we are automatically collecting data from the different data sets, right?
Correct.
So that is our tool is totally AI powered,
Mhm.
and then we create for collecting all the data, and we create a comprehensive patient profile, right? And from that profile that we can identify, we can get the data of a one particular patient on the different aspect, like it's not only clinical but clinical claim lab, the SDOH information and everything, that we can have one particular identifier, right?
Mhm.
Second part is like integrations, right? So how integration is that, like integrations is data from different sources you put into the unified platform, right? And you can get the holistic view of a patient. So
Mhm.
innovators DAP, that is called a data activation platform, and
Mhm.
our viewer, that is called a patient 363, is the 360 view of the patient data, right? So with
Correct.
the both our this both are like AI powered tool, and
Mhm.
with both light we can get all the informations about the patient in like one particular screen, right? So
Correct.
that is helping a lot for the providers, because when they have a intervention with patients, and they are looking into their EHR, they don't have the complete view of a patients. So
Mhm.
that's people and the providers right now using the P360 tool for it. Let's talk about the analysis part, right?
Mhm.
So the third step is that we have a data, right? We capture into the tool. Now we need to analyze that, and we need to make sure that it is we analyze and provides our algorithm in a way that they can satisfy the use cases, right? So like
Mhm.
innovator has like, let me talk about one use case for the like NLP based risk assessment,
Mhm.
right? So that particular AI tool that analyze unstructured data nodes, right? And suggest like the coding opportunity, like any codings are missed, or maybe
Mhm.
something that has been added into the nodes but is not added into the particular EHR. So
Correct.
we identify the gaps over there. The fourth point, I talk about the dashboards and the outcomes,
Mhm.
right? So Innovator has like a tool called InNote, that is a point of care solution,
Mhm.
right? It analyzes the medical history of a patient and suggests the quality and coding gaps to the providers. So
Mhm.
at the point of care timing, right? So when you are discussing with the patient as a provider, right? This tool pops up and gives you the idea about that. Okay, hey, this is the patient Vijay, and these are the what the histories are there, and these are the gaps that you are having. Can you just evaluate that gaps as well?
Mhm.
right? And then last, I'm talking about the decision making, right?
Mhm.
So that's actually the real AI that we can say, right? So like innovators have a care gap, the closer predictions that is helping a lot to
Mhm.
identify, like in the future, like take an example based on the previous data until 2025, how many care gap you can close, and
True.
then you can adjust the resources, right? And also like care manager assist, that is also AI powered tool from the innovator that
Mhm.
transcribes, summarize, and document patients conversations with, like patients and the provider conversations, right? And
True.
then it's stored into the like in the formatted manner that you can easily talk about that. So these are the like the processes wise, like the five
Mhm.
areas where AI is helping a lot in
No,
this, right?
that's those are wonderful thoughts, and Vijay, thank you so much for explaining us those five-step process. I know it went a little bit on a higher scale. Maybe some of the audience, even I, kind of went a bit tangential. Let me bring down the understanding level for the sake of everyone, a little bit notched down.
Sure.
So we'll focus more on the outcomes. I know you explained the process very nicely and very uh, in detail as well. So when I focus on the outcomes of the AI, we talk about, and you also touch based upon like the risk assessment. We talked about the risk stratification of the patients who are the target population health management for the implementation of the AI based tools and applications. We also talked about the data integration, which is one of the key aspects of one of those five-step process which you mentioned about. Uh, so when we are talking about AI, how it's being utilized, and basically we focus on the healthcare outcomes, we also look at the resource allocation. We also look at the actionable insights, which kind of go into addressing the larger data sets. And you talked about the EHR as well, which form an integral part of whenever we are defining or designing the overall AI implementation for the larger population health management. So give us an example, like have you from the implementation of AI, how it has been utilized in PHM, and probably what success and what's the outcome which we have achieved as part of the implementation. If you can give some examples or some general outcomes as well, what could be the potential success factors? So that will be really helpful for our audience.
No, I think as of today, like AI is still improving, and
Okay.
right, and
Mhm.
just like so till now, I believe like there are a lot of areas in the PHM that has been touched by the AI,
Mhm.
right? And the first why we are using the AI is like predictive analytics.
Correct.
So it's for the prediction. So AI algorithm analyze like vast amount of data. We talk about the data when we talk about the PHM, right?
Mhm.
And as a human, we cannot read those like the million patient data with the million parameters and then take a
True,
decision,
true.
right? And even not to take a decision, prediction we are talking about, right? So it is very much difficult for a human, for even like analytics system as well. So
Mhm.
here the AI is a crucial that can understand all the aspect of the data, right? And then give the predictions. So one of the paper that I read about, like the uh, prediction hospital readmissions, like
Mhm.
by analyzing patients record, reading targeted interventions that reduce readmission rate up to 20%. So like
Oh,
when you talk
okay.
about a 20% and we talk about the patients in the million, right? It's like
Mhm.
200K patients we are talking about. And if you
Sure.
consider the cost of one patient is like $1,000 for a ED visit,
Mhm.
right? So like 200K patient into $1,000, like
Oh, yeah.
it's
Talking
a
about millions of dollars.
huge number of dollar, right?
Absolutely.
That's the benefits, that the critical benefit that we are getting, right?
Mhm.
Another is that personalized care plan, right?
Mhm.
So we know that every human in this world are different. They have a different need, they have a different body
True.
structure, they have a different health issues even as well, right?
Mhm.
So in that particular case, we need a personalized care, right?
Mhm.
As we are moving towards like that, the one care plan that given to Fardin cannot help or may not help to me as a different person. We both are like in the north and west, living in the US, right? Yeah.
Mhm.
So that can be the chance. So AI is helping to understand, like, okay, what's the Vijay's last 5 year history or last 7 year history, how
Right.
he's living, how he's what is that healthy patterns, right? Based on
Mhm.
that, whenever something required to be there, it is helping us to create the personalized care plan, right? So
Mhm.
that is like that is to me, and then that I'm sure that will help me of improve my health faster than what the general care plan is.
No, those are nice thought. And specifically, I received a newsletter yesterday
Hmm.
when you talked about the predictive analytics and which is being utilized to address specified personal care as specified personal patients' personal needs. There was a news yesterday only. The AI tool it detected. I don't remember the name of the tool. It was a very unique name of that tool. It helped determine the potential breast cancer in a woman 5 years ago,
Okay.
and eventually the woman was diagnosed with the breast cancer at a later point of time, and but thanks to the AI tool predicting it much earlier, they
Mhm.
already had started the interventions, the specific intervention as part of the preventive care. So it was like it was subsidized, and the targeted intervention happened, and she recovered successfully. So that's one of the key outcomes. Another one which we as my organization we developed AI based automation tools, because basically because we are an IT company, we focused on the administration, the non-clinical aspect. We helped identify the bed management, the
Mhm.
front office modernization, where we identify, you as you mentioned, like rightly, the readmission rates, the hospital admissions of the patients, and then planning the bed management or healthcare infrastructure management to correctly predict, like this is a typical season, how we face influx of higher number of patients, specifically the vulnerable population above 65 years of age and everything. So we have to take care of that particular population during this time of the year at this particular location. So it really helps the hospitals, and we had that as a major challenge during the COVID-19 times, not only in the US but even in the other countries, much which have like much more advanced healthcare setup, like the Nordic countries, the Central European countries, where the system failed completely
Mhm.
because they were not able to do that prediction of oncoming slot of daily patients, the influx of patients, which was like completely impacting the overall healthcare infrastructure. But now, thanks to the last 3-4 years, we have seen much more advancements in AI. We are seeing much better outcomes and specific targeted interventions and specified, as you mentioned, the personalized care delivery process as well taken care by the AI intervention. So let me come back to the questions again. I'm sorry, I was speaking about my
No, no, I
experience.
think that's correct. Yeah,
Yeah.
you're on track. Yeah, you're not out of track.
So
Yeah.
basically, one thing which we always look at population health management, and we I'll leave aside the politics and the disparities in terms of rural and the urban divide, but we know there is a disparity in terms of healthcare being delivered to the population. So, and then we talked about the SDOH, the social determinants of health as well, which is applicable to specific population. And then we also talk about the population, which I think so in one of the responses you mentioned, the more riskier population, or the population which are at higher risk. So how does like my question to you is, how does AI it helps in identifying and addressing the healthcare disparities within the population?
Okay. No, I think that's a nice question. But I believe let's understand what is disparities from the
Mhm.
healthcare perspective,
True,
right?
true.
So let's break it down like what, how, and for whom it
Okay.
disparity means, right?
Sure,
So
sure.
like it refers to a measurable differences,
Mhm.
right, in health outcome, access to healthcare, or quality of care, right,
Mhm.
and between the different group of people, right? So when we are talking about the population health, we are talking about the group of people, right?
Mhm.
It means that a difference, a measurable difference in the outcome, that is called a
Mhm.
disparities,
Got
right?
it.
So these disparities are often linked to SDOH, like social, economical, environmental, demographic
Okay.
factors, right? Yeah. So let me take about some examples of these disparities, right? So
Mhm.
like the racial and ethical disparities, like we
Mhm.
know about that, Native American have a higher rate of chronic liver disease compared to the other racial group,
Got
right?
it.
So that is a racial disparity from the healthcare perspective,
Mhm.
right? Geographic disparities, like the rural
Mhm.
population have less access to healthcare than the urban one,
Got
right?
it.
So that is the geographical disparities. Then gender disparities, like the woman like may face delay in receiving the a timely diagnosis for condition like heart disease due to gender bias in the research and the
Okay.
care, right?
Okay.
Yes,
I, I
that is.
I didn't knew that gender bias happens is prevalent in healthcare. delivery as well.
Yes.
That's a new information for me.
Yeah. And I read that article, I think. Yeah.
Yeah.
And economic disparities is always there. Like low
Mhm.
income individuals are less
Very true.
likely to receive preventive care compared
Mhm.
to the high income group, right? Yeah. So
Absolutely.
these are the disparities. Yeah.
So my next question, since you talked about disparities and it directly affects the quality of care, because in case we are not having an equitable healthcare delivery, irrespective of the population, irrespective of the ethnicity, or rather a customized healthcare delivery, which addresses the specific needs of a particular population, the outcomes can always be varied. Outcome can always be impacted. But when we have AI into the mix of system, we know how AI can really help real time decision making, specifically for the physicians and the providers, in creating and probably designing or planning a customized patient centric plan for the as part of the preventive overall preventive care. We also talk about when I gave the examples of the overall administrative and the infrastructure management of healthcare, and then earlier we touched upon the complexity of the patient data which feeds into the overall AI process for designing the population health management outcomes. So what according to you are different ways where AI can improve the patient outcomes, specifically when we are talking about the quality of care? How does AI kind of get into that scheme of things?
Yeah. So quality of care means like delivering effective healthcare, right?
Mhm.
More safety, giving timeline, means timely manner the healthcare needs,
Mhm.
right? A patient-centered care, that is called a
Correct.
quality of care. Like, and then as we talk about like equity that we need, right? And the accessibility. So if I talk about like these are the aspect that has given by
Mhm.
WHO, right? So these are the like parameters that we can check for how the quality that we are giving as an healthcare provider to the patients,
Mhm.
right? And for achieving those uh, parameters, right, there are certain challenges are there, right? And
Sure.
let me explain like two or three challenges and how AI can help us in
Mhm.
that area, right? So
Sure.
first is like a variability and the provider expertise and the resources, right? So we
Mhm.
know that a primary care, a PCP that I'm having, that's not an expert in all the health experience or health challenges, right?
Mhm.
Yeah. So that's the first a challenge. But what US is having is like the less number of the doctors, right?
Mhm.
So where AI can help over here is that like CDSS is like a clinical decision support system, right?
Correct.
That can help a PCP to take a decision faster based on the data, right? So my PHM has the data, my decision support system based on AI can help to take a decision and then can give a faster healthcare to the patients, right? And then maybe a PCP can quickly refer that rather than waiting for five different medications and then take a decision,
Mhm.
right? On the first or second visit they can take a decision, no Vijay, this is a clinic a chronic disease, and then you need to visit, and he can refer to a different doctor or the expert or MD, right? Yeah.
Mhm.
So that can help the first aspect. The
Wonderful.
second challenge is like the bias and inequalities. Like, so when we're talking about the SDOH or some or AI, there is always a bias, right?
Mhm.
So AI algorithm can analyze large data set to uncover patterns and
Mhm.
inequalities such as disparity in treatment or the outcome for different demographic group. Let's say an example like identifying certain population receive fewer preventive screening and prompting corrective actions,
Mhm.
right? So like, so that bias is always there, right? So ultimately AI can help to identify based on the previous data that, hey, this particular providers has like large set of data, and based on data they can identify that this kind of a people or ethnicity group doesn't get the specific preventive care, and then we
Mhm.
can identify that bias, right? So that is
Got
the
it.
quality of care ultimately.
Sure, sure. No, those are nice thoughts, and we specifically touched about the care interventions, and specifically we also touched about preventive care, one of the key measures in the success of not only AI but any advanced tools or technologies or any digital transformation in population health management. Another, I just want to like shift the topic a little bit towards chronic health management or chronic diseases. We understand some of the seniors population, they are not nowadays, like it's not only the senior population 16, 65 years of age plus, but even people as early as 30, 35, and even 40 years of age. Rather, I'll go the reverse way: 40, 35, and even 30 years of age group. They are facing these chronic disease challenge. We have diabetes, we are talking about heart diseases, we're talking about arthritis, even in people as young as 25 years of age. So all these chronic disease management, it's one of the key challenges, which also puts a huge burden on the overall healthcare infrastructure, because the management or the spend and the focus and time and energy spent on chronic disease management, it kind of takes away the resources from the emergency interventions, the emergency care procedures, which probably people have to end up waiting. And that we have seen challenges in the healthcare system in Canada, in UK as well, where they have the universal healthcare system in place.
Mm-hmm.
But from the let's come back to the population health management. How is AI helping, assisting in managing the chronic diseases? How they are I'm talking about the larger implication in terms of long term healthcare of the population. How is AI intervening, and how is AI helping in the overall scheme of things for chronic disease management?
Yeah. So when I talk about the chronic disease, let's understand about like it is a long-term health conditions,
Hmm.
right? So that's the first thing that we need to uh, take into consideration. And
True.
second, we need to take into consideration that how early we can detect that one. It will
Hmm.
be more easier for the patient,
True.
more or less costlier for providers as well, the patients as well, right?
Hmm.
And a faster recovery, right? So if anything that is helping me in that particular aspect, that's a game changer,
Hmm.
right? Right. So and the third is like the predictions, right?
Hmm.
But that comes in the later side, right? So like if it is any helping me any AI tool that early detections, right, identifying the risky patient, then that
Hmm.
that will help me, right? So based on the AI PHA data, AI analyze demographic, a clinical claim, behavioral, the data, and identify a specific set of people or a group that are
Hmm.
more riskier, right? So that is
True.
helping us on the early detection of that, right? So it doesn't mean that you are identifying a one person for a clinic disease, but you can say like for a group of this 1 million, a
Okay.
20% having a critical disease, right? Means that
Got it.
it means that the the government or the public system to
Mhm.
focus on that particular area, that particular group of people, and then they can try to understand like what are the challenges over there,
Like for
right?
example, the Indian population or the South Asian population, they're more susceptible to having diabetes. They're, and the women are more susceptible to having healthcare,
Correct.
heart disease, or the cardiological diseases. So that's what we are talking about, like specific intervention, considering the
Right.
ethnicities, considering the background of the specific niche within the population, overall population.
Right. Yeah, that's correct. Yeah. And
Mhm.
when we talk about like um, the early identification, like, but you already have the chronic disease, then what? Right.
Okay.
The only thing is that you need to continuously monitor that. You need to
Hmm.
be in that particular parameter for your disease. That
Hmm.
will make sure that that will not be a critical for you, and still you can get the like healthier life with that, right? It means that any tool that can helping me to monitor a regular assessment of my conditions,
Hmm.
then it's a great game changer for me. Like so like AI tool, kind of a wearable devices like
Okay.
IoT enabled devices, right? They
Hmm.
continuously monitor like heart rate, or maybe the
Hmm.
blood circulations, right? And that can helping me to identify like is there any chances of a heart stroke, right?
Okay.
So
Got it.
that is the thing, right?
Hmm.
Another is like personalized care, like if
Hmm.
anything we touch base about that this particular point, but anything like a tailored diet plan for me as an if I'm a diabetic, then
Hmm.
it will surely help me on that aspect, right? And the medication management, correct?
Hmm.
So if
True.
I'm a patient for a critical illness, then I should have a medications plan with me. And
Hmm.
I need to make sure that I'm not missing even a single dose of that, right?
Oh.
So we have a lot of tools available in the market that is helping us to like notify to say that okay, you have not taken this particular medication, or your medication is going to
Mhm.
um, empty, right? So you can just go and collect
Okay.
another set of
Get the refill done at
medicine,
the
right?
earliest possible.
Yeah,
Okay.
yeah, so
Got
that can
it.
help, right? And
Sure.
also like the care coordination. So yeah, so these
Mhm.
are the different aspect for the critical illness. And as I said, like when you have that illness, you cannot do much more on that, but you need to make sure that it not become the worst,
True,
right?
true, true.
And today, like there are a lot of AI tools available
Mhm.
that is helping us. So that's
Okay.
it's a, I would say, like it's a best era that we are having for this critical illness.
Best era as well as probably worse because we are facing the pandemics, new kind of diseases coming and popping up, and the younger population getting affected by chronic. We never used to hear like
Yeah,
people
that's
even like within when where we grew up, like people under 60 years of age. We never heard like anyone having heart disease, anyone having arthritis. People were like walking miles and multi many kilometers. Do they were used to use bikes to travel to their workplaces. Now, like even the people like age group 16 and 15 years old, they're demanding a car from their parents just to go 2 miles away for a high school, attending the high school. So coming back to the point, Vijay, wonderful thought process which you shared across here on the chronic disease management and how AI is helping. You talked about the wearable devices. Nowadays, all the wearable devices, they are connected to the web. They are directly feeding the information real time to the providers or to the PCPs who are looking into and analyzing the data. Even if they are not present, the system is analyzing the data, the information is being transferred across the web. That's where one of the key challenge or key consideration comes into the or concern comes into the picture is about data privacy, and then how that data is being utilized. And there's, as you mentioned, we analyze the data from the larger population and then we plan for the intervention for a specific target group of population within that PHM. So when we are talking about data privacy, we are talking about the bias and algorithms in implementation of AI. Then we also talk about how to maintain the transparency. As you said, there is a huge disparity in terms of providing equitable healthcare. Even I came to know about from you today that within the men and the women population, there is a gender-based bias as well, which I thought probably was unheard, specifically in healthcare condition. From the delivery of healthcare, I know from the outcome perspective there can be outcomes differences, but from the delivery, that was a new information for me. So all these factors, they point us to some of the thing which we talk about is the ethical considerations. Ethics plays, we cannot, healthcare is one specific industry where automation is happening, but we can't leave entire automation or it entirely on the automated procedure. We can't rely entirely on the AI. So the ethical consideration when we use AI, the human intervention, that comes into the picture. So from your perspective, help us understand how does the ethical consideration when we are using AI specifically for PHM and the population health management. What are your thoughts on that?
yeah, I think that is a hot topic today. If I
True.
um yeah, if I understand like
Mhm.
what's going on about AI, right? So now AI is like giving you the answer, but you don't know how that decision came, right? Yeah, and
Shall I
everybody is like,
trust it? Shall I not trust it?
yeah,
Is
yeah,
that as reliable as a
correct, correct.
doctor? Can I hold AI responsible if probably I end up on the hospital bed because of some wrong intervention or wrong
Right,
medical
right, right.
management?
Yeah.
Uh-huh.
Correct. And then that's like good question to talk about when we talk about AI in
Uh-huh.
the population health management. So even like before AI, when we are talking about the analytics, the data privacy, data security,
Mhm.
interoperability, that those are already there. But
True.
now the new challenges come with a biasness and the fairness, right? So
Mhm.
is AI model is like being trained for this particular set of data, and we
Mhm.
don't know that particular set of data are biased or not biased, right? So if your data is already the bias there in the data, your
Mhm.
outcome will be biased, right? So
True.
that is another challenges or the consideration that we need to start thinking of as a
Mhm.
like the user of a AI model or as a provider or a bigger hospital that planning to release any PHM solution AI based, right? Another thing is
Mhm.
like transparency and explainability, right? As you already mentioned that decisions are coming from the AI, but you don't know whether how they come to that particular node or particular point
Oh
of that
yes.
decision, right? If your AI is not explainable, right, is not showing
Mhm.
what are the different parameters that has taken care, then it is very much
Sure.
difficult for you to trust,
The
right?
concept
So
of
yeah,
XAI, the explainable AI, right?
yes,
Okay.
correct.
Okay.
Yeah.
Mhm.
Another point I'm taking about the consent, informed consent, right?
Okay.
So me, I'm putting my data into the system that is AI based system. As a patient, I have to put the data, right? So
Mhm.
now I don't know like how system are using my data,
Mm-hmm.
right? So ultimately that consideration that should be provided from the providers, right,
True.
or the solution provider of the AI, right, PHM solution providers, that say how they are using my data or how they are not using my data, whatever
Mm-hmm.
that they have to provide. So that is a consent that has to be taken from the patient, because ultimately the patient is the owner,
True.
right? And like we are talking about the equity and accessibility is already there even
Mm-hmm.
before AI, right? So that is another parameter that we need to make sure that when we deploy the AI algorithm, it
Mm-hmm.
covers the all the population, not a particular set of ethnicity people,
Absolutely.
right? Correct. And the accountability, it's a critical part over here,
Mm-hmm.
like who is accountable for, and still it is like a, it's a big question, like is a developer, is a company who provide the AI solution,
Uh-huh.
is the company who provide the data, is the company who actually own the PHM solution, or the patient, right? Who are
Mm-hmm.
accountable for that, right? So in the responsible AI framework, you need to follow making sure that um, define the specific rules and conditions, and then give this kind of a solution to a patient who are actually using the PHM tool,
Got it.
that
Got it.
that can help uh, trust, right, between the patient and provider, right? And so,
Mm-hmm.
so that are the like kind of a points that we need to consider when we talk about the AI as a part of ethical side. Yeah.
No, absolutely. I totally agree with. In fact, in one of the conferences which I delivered earlier this year on the blockchain applications in healthcare, we specifically talked about the points which you mentioned. Who is the eventual owner of the data? So we have been having some of the new developments in that, specifically in the blockchain applications, is access based control, where we provide the key, the unique key of the acts of the data, the PHR, to the patient himself or the herself. So even if the data is located at hospital level, even if the data is on that in transit, even if it's encrypted or decrypted data, how is it is transited, but the key to the access rest in the hand of the patient. So eventually the patient decides who can access my data and when, and to what level the access can be provided, so that the data is not misused. And as you rightly mentioned, right, nowadays even in the dark web there has been a lot of ransomware attacks where the PHI is so vulnerable because these big corporations, they want to develop, they want to tap into the unutilized markets in Africa, the Asian, the Central Asian countries and all, where the implementation of AI is not as much deep as much as we have in the Western world. So they want to utilize the data, and then that probably might lead to some other challenges in future because of the, you can say, the abuse of data, specifically while building these AI based algorithms. So that's where I think so you touched upon rightly, where the ethics comes into the picture. Vijay, wonderful thoughts, but due to the time constraint, I know you have your time as well, on the for the 60 minutes. Let me jump to last two questions I'll ask you, in the interest of time. I had many more questions to ask, more about the implementation, more about addressing specific challenges of AI in implementation of healthcare management. But let me, in the last two questions, let me touch about some of the two hot topics which probably might be interest to the audience as well. We know, we know how COVID pandemic went by. Personally, you and I, we might have been affected as well. We might have seen our relatives, our population, our friends back home in our home country, even here in US, where we are uh, kind of we had the restrictions of movement and everything. So when we are talking about all these challenges, and typically of pandemic, and every now and then we say the World Health Organization releasing a kind of an alert saying another pandemic might be on the way. So at that point of time, 2020, when the pandemic started, the coronavirus, COVID-19 started, we didn't have such advanced developed AI implementations or AI tools and applications to manage the healthcare. Now we have, although it's still developing, we cannot say it's at the advanced or the peak level, but still it is still developing. So how do you think, in future and right now, how can AI help in addressing and managing the public health crisis, specifically such as a pandemic? Like what are the things you talked about? Predictive monitoring, you talked about regular surveillance, you talked about not only targeting a specific niche or the ethnicity within the population or group within the population. We also talked about the public health as well as the population health. So I'm coming back to the very first point which you mentioned at the beginning of the podcast, when you gave us a difference between a population health and a public health. So how does the overall utilization of AI now expand its scope to help us address the public health crisis? What are your thoughts on that?
Yeah, yeah. So actually, when I started learning AI and specifically in the healthcare aspect, right, I was curious, like, because we where I come to know that the right now today that we are using the AI that has been implemented by Google or Microsoft, the giants, like the 5 years back or maybe six
Mhm.
years back, like, and they were using by themselves only. They were not publicly available, but they were using, right?
Yeah, the
And
IBM Watson, the Google's DeepMind,
correct,
those
yes,
are some of the
they are
examples.
using for their own products,
Yeah,
own team, right? But they are not
yeah.
publicly available. So today we able to understand those aspects, but they are already
Mhm.
there. So when I
Sure.
search for the AI in healthcare activities, I come to know that not today only, but in even COVID pandemic, uh, the CDC and the big giant, they have used the AI tools for a lot of activities, right?
Okay.
So if you can consider now, like if they were used like in 2020s, the AI and then helped a lot. What about today? Like AI now grown up like almost 10 times or 15 times or 50 times or maybe 5,000 times bigger
True.
than what they have in the 2020s, right?
True.
Yeah,
True.
even I cannot measure that. I don't have the data. But,
Yeah.
but the thing is that if we have anything coming up like in the kind of a pandemic, then I'm sure like
Mhm.
AI will surely help a lot. So
Correct.
I want to touch with like 2 or 3 points on that. Like
Mhm.
first of all, the early detection of surveillance, right? Like AI
Mhm.
can analyze large data set from diverse sources and identify what are the root cause of that, and then they can detect uh, uh, the pandemic or they detect the issues, right?
In real
Like
time as well. In real
yeah,
time as well, right?
correct, correct, correct.
Mhm.
And I when I searched for that, I found that like the companies like Blue Dot and Health Map, right? So
Mhm.
they were using the AI and helping the CDCs, right,
Okay.
to understand like what are the root cause of this, and then
Got it.
how they came, and then they found the root cause. Like it's started from the Wuhan in China,
Mhm.
right? So I think that was
Mhm.
the right example for 2020's
Correct.
time, right? Another is that like predicting spread and the modeling, right? So we
Mhm.
didn't know like how fast that is spread across, like from one country to another country, one space to another space, like very fast, right? So AI right now help over
Mhm.
here is that understand the populations, understand the criticality of the virus or anything, any issues over there,
Mhm.
and can predict that, okay, what are the chances of spreading that one, right? And
Okay.
how can we model, like how can we jump from one particular a group of people or one particular place to another one, right? So that
Mhm.
AI can surely help in the future. uh,
Correct.
Another point that I want to cover is like early intervention or the diagnosis activities, right?
Mhm.
And also like the vaccinations. Like so, in the past as well, in the COVID time, also CDC used the vaccination development as well as how it can be applied to the users and how it can be applied to the patients, right?
Mhm.
That can help overall reducing the impact of that.
Okay. Sure. Wonderful thoughts on that. Thank you for your time, Vijay. My last question is, what do you predict for future? How do you see the future advancements? You talked about the NLP, the enhanced LLP, how NLP, natural language processing, how is it helping develop more structured and more advanced algorithms for utilizing the data into AI. But we might see in future, like the utilization of unstructured data. We might see the requirements, as you rightly mentioned right now, about real-time healthcare monitoring. We are also talking about the interoperability because of wearable devices, the data being transferred between them. Some of the things which I can understand or probably think about. But what, from your perspective, how do you see or how do you foresee AI kind of further revolutionizing the population health management?
No, I think that's a good question, and we are almost on time. But let me give a briefly thought about
Sure.
that. What I'm thinking, like, and I can compare like what is today and what is the future. Like so, today now AI is predicting like readmissions, right? They
Mhm.
are predicting chronic disease, right?
True.
Their accuracy is still debatable. Like we are not
Mhm.
100% sure it's accurate, but I'm sure that with the new technologies, that accuracy and the prediction will be more accurate in the future. So
Mm.
that will be a the major benefit that I'm looking around. Second time, as you already told, like the wearable devices, right? So what is happening today? You have five devices that you are wearing on, right? And all the five devices are working independently to identify one particular use case, right?
Okay.
Your
Uh-huh.
sleep a meter,
Monitor.
or maybe your
Yeah.
watch, or they are independently working, and they are giving one particular use case. They are giving some solutions. But in the
Uh-huh.
future, I can see that all the six devices that you are wearing all are the connected data, and then
Okay.
out of that, AI can generate a one particular decision. Hey, Vijay, you have this challenge, or you need to go with a walk today. Otherwise,
Mm.
you can have a something chronic disease, right? So I think that is the base thing that I'm looking around, and I'm sure that we are that future, right? It will be there in like in coming months. I'm not sure
Yes,
coming year,
yes,
but it
but
will be
we
there.
have to, but we have to listen to the AI's guide, the recommendations as well, right? They
Yes.
will say. Uh-huh.
Correct, correct. And the third topic I want to touch base about the SDOH, right?
Mm.
So it's a critical for health, right? So
True.
in future, it will not only predict the community at risk, but it also predict that how we can take out that risk for the for the community as a whole, right?
Mm.
It's not only about a one particular patient,
Mhm.
right? Also, I'm looking around the behavioral and mental issues. Like there are a
Mm.
lot of cases today in sorry, in the fast paced environment, right? The behavioral challenge, and then a mental challenges, right?
True.
So I'm sure that this particular AI can help us to like what my behavior is. Sometimes we don't know like we are doing, right?
Mm.
And then that leads to a behavioral challenge or the mental health issues, right?
Absolutely.
So
Absolutely.
probably my the wearable devices, or my sleeping cycles, or my how I am speaking, like how I
Mm.
am I'm thinking about, right? So based on that, maybe it can help me, it can give me idea about, Vijay, you might have a challenge, just take
Mhm.
care of that, right? So these are the like the future, and I'm seeing the future as like is the near future, not even like years after, but in the near months, a few months later, maybe we can have those kind of solutions ready with us. Yeah.
No, that's wonderful thought. Probably when you mention about behavioral aspects and about the mental health condition, I don't want to specifically mention, but we had this incident recently in Wisconsin about the school shooting. Then we had concerns. So one side of the population in the United States, they talk about not only about the gun controls, they also talk about the behavioral aspect and the mental health management of these students or the population or these people who are kind of these weird people who just go around killing students in the schools and all. That's where I think so AI can help a lot. We might have something like I hope I'm not sure, I don't know, but but something like we see in the movie Minority Report, the AI could predict the future of that particular person, of the future crime he or she might be committing in the coming years. We never know, we might
Yeah.
have something, the actual tangible solution, something like that. That's how
Correct,
as
correct,
fast
correct. Yeah.
AI is developing over the last few years, and specifically in the last few months as well. But Vijay, I know we are already top of the hour. Thank you so much for your time. Thank you so much for sharing all the wonderful information. I personally learned a lot. In earlier before this call, I didn't knew that there is this difference between population and public health management. I thought they were one and the same. But you helped us explain the concept wonderfully and very in a very simple way. You gave us some wonderful examples, and also how AI is helping, how AI has helped, and we were even not aware like AI has been utilized in private areas and these by these big corporations for many years. Now we are seeing the tangible outcome. Now we are seeing the results, and how probably we can see it grow in the future. So thank you so much. Any parting thoughts from your end?
No, I think Ferdin, thank you for having me on this, and even I learn a lot from you. Yeah, you are also like coming up from this kind of background, like population health. You are also delivering a solution for population health. So yeah, I learn a lot from you as well, and thank you for your time today and
Sure.
allowing me to
Thanks,
speak.
Vijay, and
Yeah,
hope to
thank you very
collaborate
much.
with you in future. Thank you so much. You have a good rest of the